On the menu today, we continue to keep you updated with the latest COVID-19 stories across Africa. It's all systems go as schools across the continent are set to resume with strict measures adhering to lockdown rules. And we meet 3 robots deployed to work with COVID-19 patients in the east. But later on, we cross over to the west to see how a 31-year-old visually impaired blogger is becoming an activist for differently abled people in her hometown. So Jumbo, Dumela, and welcome. I am Dumelo Mototwane, and this is #Africa. After months of no classes in most countries across Africa, Tunisia is resuming with school as part of a plan to ease down lockdown measures which were imposed to prevent the spread of the coronavirus.
Classes in Tunisia have started under strict health rules as part of a plan to ease lockdown measures and resume daily life while limiting the spread of coronavirus. With over 600 reopened schools, Minister of Education says strict precautionary measures will be observed, including the enforcement of social distancing, face masks, hand sanitization, and the regular disinfection of school premises.
الاحتياطات معناها هي بروتوكول صحي اتفقنا فيه مع وزارة الصحة، يعني ما ناش نلعبوا، احنا نرجعوا الخبراء والهيئات العلمية اتفاق معناها دليل إجراءات صحي صارم يتعلق بالتباعد، يتعلق بارتداء الكمامات، يتعلق بالجال المعقم، يتعلق بتعقيم المؤسسات التربوية، يتعلق بأدوات قيس الحرارة. أكم شفتوا على الأقل معناها عينة من التمرين هذا مطبق بصرامة معناها في كل مؤسساتنا التربوية.
Student Yassine Wakobi says he feels scared as he goes to school for the first time.
أنا واحد من الناس قبل كانت الناس كل تخاف، توا أكثر فيهم في الشارع. أنا بخاف على عائلتي بالطبيعة، فما شوية خوف، فما مش كما قبل. توا الناس ترى فيهم في الشارع في الليل دور وكراب وعادي والبحر معبي. تحس حكاية وسيبا باقي فما خوف، باقي ديما فما واحد يخاف على روحه وعلى عائلته.
Another student, Wael Arfowi, is worried about his skills after being away from school for such a long time.
بالنسبة لرجوع لقرائي نحس في روحي متوتر خايف، عندي برشا ما قريتش، معني حتى النيفو طاح، كيفاش باش نرجع كيفاش باش نبداو، بروجرام واقف وبرشا مسائل معناها اخرين اصحابك ما تعرفهمش وهذا ما تسلمش عليه، ولازم واحد يكون معناها لازمك تفرض على روحك الوقاية بينك وبين غيرك، هذا مش مستنسين بيه، نحن حتى شيء يأثر على الجو.
The Education Ministry and the Ministry of Health are working together to perform rapid tests that screen students who have travel history from another state.
التيست ذا تقصي لانتشار عدوى فيروس الكورونا قمنا به بالنسبة لتلاميذ البكالوريا اللي باش يجتازوا امتحان البكالوريا خارج ولاية تونس، يمشيوا ولايات أخرى، اللي باش يجونا من ولايات أخرى إلى باش يعديوا البكالوريا في تونس. التيست هذايا نقوموا به هو تيست سريع، النتيجة نتاعو تخرج بين 15-20 دقيقة.
The North African country has so far recorded 1,051 coronavirus confirmed cases and 48 deaths.
Medical practitioners are now receiving extra help with COVID-19 infected patients to minimize the risk of contracting the virus. We'll meet Akazuba, Ikizere and Ngabo as they report for duty at the Kanyenya COVID-19 treatment facility at Rwanda's capital.
Meet Akazuba, Ikizere, and Ngabo. These are no ordinary healthcare workers. They report for duty at the Kanyenya COVID-19 treatment facility, a short distance from Rwanda's capital, Kigali. The African nation has deployed these robots in a bid to minimize contact between patients infected with the coronavirus and doctors and nurses.
They help us to decrease or reduce the risk of transmission from patients to staff. Let's say before we had them, would visit between 2 to 3 or 4 times a day per patient, but now at least we now up to 2 times a day. So that tells you how helpful they are and what impact they have made in terms of reducing the number of visits to the patient.
The sleek white robots with their big bright blue eyes carry out simple tasks like take temperatures, monitor patients, take readings of vitals, and deliver video messages and feedback between doctors and patients. Officials said the bots will be programmed to carry out additional tasks as well.
If you program them, they can take a tray to a patient, with the products you want to bring to the patients, they can bring them. But for now, we are using them for those tasks.
The robots were donated by the United Nations Development Program. Rwanda already uses drones to deliver blood and enforce restrictions designed to slow the spread of the coronavirus. There are 2 more robots at the country's other COVID-19 treatment center, Nyamata, in southeast Kigali.
Amid all the COVID turmoil, there is some positivity wheeling for women in Zimbabwe. A new electric-powered motorcycle is helping bring income to unemployed Zimbabwean women, easing burdens of looking after their families during the lockdown.
This woman in rural Zimbabwe has found a way to make life much easier during lockdown by hiring out an electric motorbike. It's part of a project being piloted by startup firm Mobility for Africa, where they lease out solar-powered bikes, known as Hamba, to groups of low-income women. It's particularly helpful for health workers like Pamidzai Matunya. She found some pregnant women walked 12 kilometers to the nearest clinic to give birth because there was no transport. But the bike has changed all that.
This Hamba motorcycle has made it easier for me to ferry patients to and from the hospital. We now have fewer cases of pregnant women giving birth at home due to lack of transport to the clinic, as was the case before.
Mobility for Africa said women pay around $15 a month as a group to lease the Hamba. It has a range of 100 kilometers and costs up to $1 to change the motorcycle batteries, which are charged at a solar-powered station. Fadzai Mavuna works for Mobility for Africa.
Women in the rural areas carry the burden of carrying firewood, going to fetch water to drink, and carrying school kids to the school. So as Mobility for Africa, we saw that we need to lessen the burden on women. So we needed to test with the women so that we can see if they can be able to do some productive work during the time by saving time and saving their income.
The bike means rural women can now carry farm produce to distant markets, bringing in some extra income during lockdown. Mobility for Africa is now in the second phase of the pilot project for the Hamba, before it can go commercial.
But still to come on #Africa, we'll head west to find out how a visually impaired blogger is becoming an activist for differently abled individuals in her home country of Nigeria. Now to West Africa. A 31-year-old vlogger who lost her eyesight 2 years ago is becoming somewhat of an activist for differently abled individuals in her home country, calling on the government to provide more support to those who are dependent on others for their normal daily routine.
How do you keep social distancing if you cannot see? For Lawal Adebimbe, a 31-year-old baker and aspiring blogger, losing her sight 2 years ago was hard enough. Now the coronavirus pandemic has made her life in Lagos even more difficult.
It's been really, really difficult. When we first had the first case, to us as a visually impaired person, it was like a bomb, or person living with disability, it was like a bomb. Because for a visually impaired person, I have to depend on people to go out. I have to cross the road, I have to walk around, get the bus.
The city's lockdown started lifting earlier this month, but national restrictions like mandatory masks and the curfew are still in place. For Lawal, even an everyday activity like crossing the road can even be a struggle because of social distancing. Unlike in other countries, Nigerian traffic lights do not make a sound when pedestrians can cross, and the lights often do not work, leading to her having to rely on friends. Juliet Wefui lost her sight in 2013 and runs the Yeyedu Outreach Foundation for visually impaired people in the capital, Abuja. Her charity is trying to help.
Using a facial mask is something that is still strange to me, and I'm still learning. But these are some, adjustments that I've had to make. Also, washing of hands. I wash my hands very, very often. As often as I touch surfaces or touch people for help.
Still in West Africa, Senegal's tourism industry has been at a standstill for more than 2 months now. Hotel owners are calling on government to revisit their sector's lockdown rules.
In Senegal's Saloum Delta, hotel owner Lionel Lopez shows us his guests' favourite place to enjoy a drink. But it's been months since any have been served. With borders closed, West Africa's tourism industry has been put on hold since mid-March. And Senegal is a vacation hotspot. Tourism accounts for about 4% of their GDP. Lopez's 15 employees have survived on a reduced wage, thanks to an emergency loan from the government.
Countries where tourists come from have put in place restrictions. For example, France, which produces the most tourists coming to Senegal, clearly said people will go on holidays in France, so we won't have French people this summer. However, we are lucky to have an important customer base for the expat and the local community. We are waiting for the reopening on cross-region transport links in order to reopen the hotel. It is a good part of our income, 35 to 40%, and with that we will be able to reopen properly, hopefully in a month's time.
But others are not so lucky. Across the silent lagoon on Marlodge Island, women who used to earn up to $17 per day selling woven baskets and carved souvenirs are struggling to support their families. Amy Diouf is one of them.
We've not sold anything in 2 months in the village. That's our only work. Women do that and men work the land. With that, we can help out the family.
Even if international visitors are allowed to return soon, the over 2-month hiatus means tourist numbers this year will be far below the 1.7 million who holidayed in Senegal last year.
And still in Senegal, Salih Cissé, a Senegalese artist, is working on a new series called Corona. He says the COVID-19 pandemic has not only changed how he lives, it has changed the way he sees the world.
Renowned Senegalese artist Salih Cissé once painted figures very close to each other, illustrating the constant social interaction in communities and families living in close proximity in his country. But now Cissé says the COVID-19 pandemic has not only changed how we all live, but also the way he paints his interpretation of the world.
J'ai remarqué depuis un moment que mes personnages sont séparés entre eux.
I've noticed for a while that my characters are separated, and it changes the way my work is read, because I usually accumulate my characters, they overlap, there's a social aspect, characters touching was important to show that there was a link between us, but now we have no choice. It's as if this gap was forced on us, the distancing was imposed, and we have to live with it.
Entre nous, mais là, on n'a pas le choix.
Cissé, who is working on a new series called Corona, describes the novel coronavirus as an indomitable adversary that people fear and is redefining the way individuals perceive themselves and each other. This year's biannual event in the Senegalese capital showcasing the best of African art got cancelled. Cissé hopes the organizers will wait until 2022 for the next meeting to give people time to heal the wound of COVID-19.
So Corona is a period, but a period that will mark us for life. So these paintings for me are paintings that stand as witnesses to an extremely difficult, a hard period that we won't be forgetting anytime soon. So for me, these are works that will remain in museums.
Donc pour moi, c'est des œuvres qui vont rester dans les musées.
And still to come, many Kenyans, countrymen, are keeping fit and healthy, even if it means breaking the law. This is #Africa. Let's take a quick look at news making headlines across the African continent. Nigerian producer Samuel is recording a new television series about a highly infectious disease that has ravaged the world.
Action!
Nigeria's multi-billion-dollar film and TV industry, better known as Nollywood, is slowly creeping back to work after lockdown. Actors and crews are returning to sets under strict social distancing guidelines. Filming of TV series Meadows was halted for 2 months, but resumed in mid-May with a production team of 7, around a quarter of the people in a regular Nollywood crew. Producer Samuel Idiegabonya explains.
It's been very cumbersome. I, as a producer and as a director, it's been from the position of order before now. Just give instruction and you have PAs on set running to get this done. But because of this pandemic, I have to do everything, not everything, a lot of things myself.
Bottles of hand sanitizer dotted around the set point to the impact of recent events, along with face masks worn by production crew and actors delivering their lines at a much greater distance from each other. For lead actress Inim Fonigene, it's a scary time.
There's that fear because we are in that phase where we really do not know what can happen or what could happen. But now there are precautions on set that would have to follow and adhere to, so it makes us a little bit more comfortable.
The pandemic has left Nollywood in deep trouble, according to industry bosses and financial analysts. Cinema closures across Nigeria due to the lockdown have been described as catastrophic for the industry, which gets half its revenue from ticket sales. Cinemas in Nigeria are still shut indefinitely, and some experts predict that up to 250,000 people employed in Nollywood, from designers to box office attendants, could lose their jobs. One estimate suggests the pandemic has caused the industry losses of around $8 million since mid-February.
Kenyans are keeping themselves in tip-top shape, this despite the lockdown in the country and their regulations. Taekwondo champion, that's Vincent Ochieng, who is set to represent Kenya at the World Taekwondo Championships in China, is not letting a global pandemic get in the way of his bid for the title.
Closure of gyms and other sports training facilities in Kenya remains closed as part of measures to contain the spread of coronavirus. This left Taekwondo champion and others with little choice but to train at one of Kenya's busiest motorway flyovers. Vincent Ochieng now trains here with his daughter Stacy. He is currently preparing to compete at the Taekwondo World Cup in China this year.
This year we were planning, and that's why I'm training here. That's why I'm here today. We are planning to represent our country in October. That's in China World Cup, Taekwondo World Cup. But unfortunately, this COVID-19, we don't know itaisha lini. We are just praying and hoping itaisha before that time.
The group has received backlash with their presence outdoor, as many participants are not following the correct lockdown laws put in place by the Kenyan government.
They will give us this disease, they will still spread it more. If an individual, if one of them maybe has been affected, coming to train here with, I don't know, 5 or 10, it is nonsense. I don't see the meaning of that training in this area. If I know I've been told that I stay at home, let me stay at home.
But for Vincent, training at home is impossible. He says that without a training program, his chances of winning more medals is less.
This is what I do best. It's my life. I survive through Taekwondo. I'm a teacher. I teach Taekwondo in schools and in halls. And when the schools were closed, the halls were closed, everything changed. Our life became hard. We can't survive. There is no way you can survive. There is no way you can train your kids. There's nowhere you can train your client. So I will ask government to come up and support sportsmen and women, because this is what we do.
These early morning training sessions continue to attract hundreds of residents in Kisumu, including basketball players, footballers, and even dancers. They say the motorway is the only place available to train.
And that's it from me, Dumelo Mototwane. Keep the conversation going on Twitter. We are at Africa_ENCA. But we leave you with these beautiful pictures from our beautiful continent of Africa. Until next time, goodbye.